Friends, welcome back. It is Michael Parker, and this is Michael Parker Media. And today I'm joined by Pamela Binns-Turner. She's coming to us from Biloxi, Mississippi. She is a CRNA, which is a certified registered nurse anesthetist. And what we're talking about today is ketamine infusion therapy. And this was a subject that had been recommended to me by some folks, and it's something that I'm interested in as well. So this is a fortuitous opportunity to talk about this. So Pamela, first of all, tell our audience a little bit about who you are, your career, and what has led you now to working in ketamine infusion therapy.
Well, I have been a CRNA for 27 years. Prior to that, I was an intensive care nurse. I had done my bachelor's in nursing, my master's in nurse anesthesia. I did my PhD in nursing. So I've worn a lot of various hats over the years, but I've continually been an anesthesia caregiver as a CRNA. So I've been a dean of nursing. I've been a program director for nurse anesthesia programs, but now at this point in my career, I'm trying to more or less, hone down and wrap up what I really enjoy the most. And that is truly giving anesthesia. And I've found that, we're sort of born with a desire to help people as nurses. That's who we are. And so I began to do a little research in it. Ketamine is experiencing a resurgence in popularity in anesthesia. It's an old anesthesia drug. It's been around since the 60s. But what we're finding today in anesthesia, we use very small doses in our general anesthetics and in our sedations, and patients do extremely well with that. So in finding, a new love again for ketamine, I began looking at other ways it could be used and came across its success in helping patients who have treatment-resistant depression, anxiety, what most people collectively call mood disorders. So everything from depression, anxiety, OCD, PTSD, substance use disorders, those are all kind of collectively grouped into that category. It is also successfully used in patients who have chronic pain, neuropathic kind of pain, which means it's more of a nerve-driven etiology that causes the patient to experience pain. So it's not helpful in a mechanical type of pain. For example, bone-on-bone knee joints. Can't fix that. You need a knee replacement for that. But if you have some pinched nerves, you have, a pain disorder that is being created by nerves that are firing and causing you to feel that neuropathic pain, then ketamine can be very successful in helping to improve that. So in my interest in that, myself, several CRNAs I work with, one is your friend from Texas, and we all kind of came together and said, hey, there are no ketamine clinics in this area. This is a ketamine wasteland, basically, here on the coast. We have a few in Louisiana. We have a few in Alabama near the coastal areas, but nothing really in Mississippi until you get to the middle of the state. There's one, and then maybe one in the northern part of the state. So we were like, this population here really needs this therapy available in a clinic locally. So that's how Neurokare was birthed.
So are you saying, and I was not aware of this, I'm in Los Angeles. I know that there are some ketamine clinics in Beverly Hills. I do not know how many there are. Is ketamine therapy at this point in the game, is it still really sparse nationwide, or is it just your region that doesn't have a lot of it, or?
It depends. In the larger cities, they're, like Atlanta or Birmingham or Memphis, probably there in LA as well. There are quite a number of ketamine clinics to choose from. Many are run by various healthcare providers. It's usually someone in healthcare that understands the ins and outs of administering ketamine successfully that create these clinics. Safety is paramount. Ketamine is a very powerful drug, but it's also a very safe drug if used in the proper dosages.
Let me ask you this about ketamine,
Mhm.
because I don't know anything about the various anesthesias that we use to put people under.
Right.
But I read that ketamine is considered a dissociative
That's
anesthesia. What
correct.
what does that mean?
Well, what it means is it actually works in a manner to um, take your cognitive awareness and sort of separate it from your body, so to speak. If you were going to say, "Oh, I'm having an out of body experience," that's an example of something being dissociative. Um, Ketamine, if it was used as a sole anesthetic to put somebody to sleep, which it really is not anymore. I'm sure you're very familiar with propofol, the Michael Jackson drug.
Yes.
We use that almost 99% of the time
Mm-hmm.
to induce a patient to make them go to sleep and then be maintained with volatile gas that they breathe and oxygen. Ketamine is, in today's use in my hands, is an adjunct drug that I use along with the propofol or along with other medications like Versed to sedate somebody, to make them comfortable, or to help them do better under anesthesia. It has a way of supporting blood pressure and supporting heart rate, which normally an anesthetic like propofol and volatile gas that you breathe tends to lower blood pressure and can lower heart rate. So ketamine is a nice way of offsetting that, so to speak.
All right. And I was watching some other videos. I mean, I guess it was actually even used in Vietnam for
Yes.
some people on the battlefield. So are they,
Mhm.
before we move into ketamine therapy, I just want to understand a little bit more about ketamine
Sure.
itself. So
Yeah.
are you saying that back in the day, I could have been administered ketamine if I was injured, but I could still function?
I wouldn't say function. You'd
Okay.
be aware of what was happening, possibly aware of what was happening, but you'd also potentially have less pain because it is an analgesic drug. It does reduce pain. And you'd also maybe having, if you were given a large enough dose on the battlefield, it would stabilize your vital signs. As I said, it raises blood pressure and heart rate. So that's a great thing if you're bleeding out and you've got a serious wound. But you probably at that point also would have hallucinations, dissociative experiences, which could be pleasant or they might not be pleasant, depending on how much ketamine you were given.
Understood. So some people may be thinking, well, and in full disclosure, I have never used ketamine in a recreational or medicinal
Right.
way. Apparently, a lot of people have, and there's a lot of videos
Mhm.
about that. I first heard of ketamine, I guess, in the late 90s, perhaps. And at
Right.
that point, it was being used recreationally. I don't know much about that, but in my research about ketamine, here's what I found interesting, because I'm
Hmm.
very interested in maintaining brain health. I have mental illness in my own personal family. I've suffered from depression, but
Hmm.
also as a person who's getting up there in age, I am wanting to maintain the health of my own brain. And what I'm
Sure.
reading about ketamine is that it can increase neuroplasticity.
Correct. I'm
That's
excited you know
huge.
that word. It is huge. It's a fancy medical term, and I try to break it down a little bit for people because they're like, "What is neuroplasticity?" And in layman's terms, because when I'm speaking with my clients, I need to use layman's terms. It's To me, it means that the connections in the brain, because of the illness, the mood disorder and so forth, they are becoming less effective at transmitting messages back and forth. So sometimes I think of it sort of like sticky connections. The message isn't getting through.
Mm-hmm.
And what ketamine does is it goes in there and improves that neuroplasticity and basically cleans up those connections. It actually, it's an NMDA, it has effects on the NMDA receptor, but it also, I was just reading the other day, I knew it at one point, but I'd kind of forgotten that it causes a glutamate surge, which actually can transform the end receptor that the glutamate is coming out on. So it is potentially improving the connections in your brain for a while. It could be a longer term effect. It might be a little more short term. But then think about it. When I inject a ketamine infusion into a patient intravenously, it's not just going to the brain, it's going systemically all over the body. So that's why it's also helpful in chronic pain, because you have those same transmissions going to your left leg, going to your right leg, from your lower back, whatever it is. And it can help clean up those connections as well and help the transmissions go through more smoothly.
Well, just, here I am just trying to understand this. And when I'm reading about glutamate and the fact that glutamate is this powerful neurotransmitter, but it's also this amino acid, I'm also reading, and, this is the internet, so correct me if I'm wrong, but the amino acid is supposedly, this particular one is the most predominant one in the human body. And I read a statistic that said the typical human has about 4 pounds of this amino acid. Yet, so me thinking to myself, I'm thinking, well, wait a minute, if ketamine therapy is good because of this glutamate increase in neurotransmitting and all that, well, shouldn't I go and look for foods that would increase my glutamate? But then the first thing I see is, don't eat foods with a lot of glutamate in it. And they mentioned MSG. So where am I, where am I missing the point here? What's going on here with glutamate? Is it just poorly understood?
Yeah, I think so. I mean, there sometimes we try to simplify our health and say, well, if glutamate is good, then I need more of it and I'm going to ingest it. But that may not be the form that your body actually needs.
Understood.
It may be a byproduct that comes from something else. And I think you'd probably have to talk more to a anatomy and physiology person to get the lowdown on that. I'm not that well versed in that area, but it's one of those things that, you think, hey, this could be beneficial for you in the long run, for sure.
Well, that's what I'm thinking. So let's move on to what you do with ketamine infusion therapy. Now, your title at Neurokare, do I call you a ketamine infusion therapist? Is that your title?
I don't think I have a title. I'm the chief flunky, pretty much. No, we're all advanced practice nurses that are administering this ketamine, and so we're just facilitating basically the therapy for our clients. We hadn't even really thought about a title.
Understood. All right. Well, let's say this. Let's say I have been experiencing long-term depression. I've had therapy. I've been on Zoloft or whichever SSRI or whatever it is, And I'm just feeling like I've hit the wall. This is not helping me. I reach out to you, walk me through if you would accept me or deny me, what would be the reasons for that? And if accepted, what happens next?
Right. That's a great question. Well, people are very informed and liberated, really, in terms of the information out there on the internet. Now, you have to weed through it and see what is valid and what's not valid. But people do a lot of their own research and in trying to have wellness, be part of their lives. So many times what happens is someone finds our website, Google searches it, Google Maps, whatever, and reads about our website, reads about the services we provide, and they contact us. So that's the first thing, is they would contact us. We have a person who answers the phone and gets all the information. And then if they feel like, the person wants more information, then they give it to one of the providers and we call them back and have a conversation. But the main thing is that ketamine needs to be, it's most successful in treating things that have been treated by more traditional processes, but were not successful for the client. For example, ECT therapy, very successful for some people, not successful for others.
I'm sorry, what is ECT therapy?
Oh, sorry, electroconvulsive therapy, where it's shock therapy. Yeah, where they induce
we still
a seizure.
do that?
Yeah, we do.
Does that help?
Well, for some people, it really does help. But I did anesthesia. You go under general anesthesia because you don't want to feel that seizure, obviously. So I've done anesthesia for it, and it makes it makes me cringe to watch it. But if that's something that can help people, then
Okay.
it's what we need to do. But I'm using that as an example.
Sure.
Also, antidepressant therapy. We get, many times there's a process that a patient has to go through to see if they're going to be helped by that. And the unfortunate thing is, and this is well known, is that you will start a medication, and I'm sure you know this, it could be 6, 8, 12 weeks before you begin to see any of the benefits. That's a long time to have
Yes,
to
it
wait.
is.
And then it's like, okay, well, we need to add another medication, or we need to increase this medication. We've had some clients. I have one I'm working with right now, a young person that is maxed out on all the doses of anything this person can take. So this is the last hope for this person, that ketamine therapy would be able to lift that darkness that they're experiencing, because medication is not doing it. So they would come to us basically, and we ask them, give us some documentation from your provider, whether it's a psychotherapist, psychiatrist, psych mental health nurse practitioner, or even a primary care person sometimes is managing the mental health problem. But give us some documentation that shows how you've been treated and what you have experienced so far. So that's the first thing, is determining that they're eligible for ketamine therapy. And also, more even as important, who's not eligible for ketamine therapy. There are certain conditions, if you have severe heart disease because of that increase in heart rate and blood pressure, that is transient when you're getting the infusion. But if you start at an extremely high level and then, go higher with the infusion, that's not a good thing. That could put you in jeopardy of having some health issues such as a stroke or a heart attack. So we don't, we rule people out who have uncontrolled hypertension and heart disease. Some, if you've got liver failure, kidney failure, those would not be candidates. If you have increased intracranial pressure in your brain, that would be a person who's not a candidate. So it is up to us really as providers to rule in or rule out whether this is an option for you. Once we do rule it in, then generally we either meet face-to-face or have a consultation on the phone, answer all of their questions, which include everything from, how do you dose the ketamine? How often do I have an infusion? What do I expect when I come to the clinic? And then we set a time that they come. We meet them, get all the I's dotted and the T's crossed and the orders written, and our medical director sees them and okays the orders. Then when they're ready for their infusion, they come in. We start an intravenous IV with a catheter. We hook them up to monitors. So we're monitoring their blood pressure, their heart rate, their oxygen saturation, and then determine what the dose is. We actually give them the infusion of ketamine in normal saline. So it's in a diluted out liquid. We give them a pre-anesthetic anti-nausea drug, because we don't want them to experience nausea with it, which is a potential for some people. So we give them that, and then we start the infusion. And if it's a mood disorder infusion, it runs about 40 to 45 minutes. And then during that time, they're going to, usually we have a recliner, they relax, listen to music, very relaxing music on noise canceling headphones. They may elect to put an eye mask on just to keep the light out, but we dim the lights and make it as peaceful and comfortable an environment around them as possible for their infusion. Then when it's finished, we turn it off, let them, at the minute you turn that infusion off, the blood pressure and heart rate return pretty quickly to baseline. And we monitor them for 30 to 45 minutes to make sure that the most obvious effects of the ketamine have resolved. and that they are steady enough to walk out of the clinic safely. We do require that they have somebody to drive them home. They can't drive for 24 hours after the infusion because it is an anesthetic and we treat it as such. So, we don't let them eat or drink anything the night up until midnight the night before. So we want to reduce that potential for nausea with the infusion.
Let me ask you this. So I was watching a video yesterday of a person who was having an infusion of ketamine, and this person was describing generally a sense of well-being, oneness. And once again, in full disclosure, yes, I've used psychedelics, so I understand what that is like. And this would loosely come under psychedelic therapy, the term. But when I think of psychedelics, be it psilocybin or MDMA or something like that, I'm thinking about something different. This sounds more like a calming. When I think of sedatives or anesthesia, this is what I'm thinking about, not a psychedelic experience. But what would you describe the experience as?
Well, I can't personally describe it because I have not experienced it, but I've certainly seen plenty of our clients. And I'd say 80% of the time, it's a very peaceful, calming thing, but they will have perhaps see very vivid colors, smell the color orange, things that you don't normally, you don't normally think of when you're in full cognition with all your faculties. It can bring up, especially with PTSD, it can bring up past experiences, and that's part of the benefit of it. Certainly, if someone is undergoing what they call KAP, which is ketamine assisted psychotherapy. So in other words, they're having their infusion, but there's also a psychotherapist there guiding them and talking with them. So that's one thing. We don't offer that currently, but some clinics do that. So you can bring up some past experiences and really make some headway by, having the ketamine more or less help bring down your inhibitions, open your mind to, other possibilities and so forth. There is a few times that a person goes, wow, that was not pleasant. We had someone, their first infusion, he says, I felt like I was taking off on a rocket ship and I didn't know if I was coming back. And, we were carefully monitoring him and checking in with him and so forth. But that was just the first time. The next, 5 infusions were just great. And I really do believe it's part of what the client brings mentally to the infusion. So, if they come to the infusion with negative thoughts or this just, I've tried everything, this just isn't going to work, then oftentimes their experience may not be as pleasant as it could be. Whereas if they come with a more positive attitude that, hey, this might be something that is really going to help me make that next step in my wellness journey, then many times they have a more positive experience.
And typically you would have the patient do six sessions?
Right. That's kind of the minimum for, ketamine therapy. Some sources today are saying anywhere even from 6 to 10 infusions is what you would expect over a period of 2 to 3 weeks, usually. For mood disorders, you split the days. You have a day of infusion, a day after rest, and then another day of infusion, or you may even have several days between your infusions. And that just really allows your body to sort of adjust to the changes that it may have experienced with the infusion. So anywhere from 6 to 10 infusions. And then at that point, it's time to kind of assess the progress. Through that process of infusions, we use various tools to assess whatever their complaint was, whether it's depression or whether it's anxiety or whether it's PTSD. We want to know ourselves, are we trending in the right direction? Are we improving over this series of infusions? So we can look from the first time we test them, with the first infusion to the end and compare the two just to see. And generally speaking, it's quite a dramatic change.
What is the array of issues that you can treat with ketamine? Because we've mentioned depression, we've mentioned mood disorders. Give me examples of the ones that you've treated with ketamine.
Mostly, probably the most common are depression, severe anxiety disorder, OCD. We're starting to see some PTSD. We have a lot of veterans here on the coast. We have a big veterans home here, retirement home, and a VA hospital. So we're starting to see more of that. You can treat migraines with it. You can, suicidal ideation is something that we prefer not to cross into. I think that is, really something that, because of the severity of it, we don't want to trigger something that's going to, be mortal for someone. So we don't tend to, and schizophrenia is generally something that, that's better treated in other methods. But the depression, OCD, anxiety, substance use disorder, migraines, and chronic neuropathic pain are the main diagnoses that we see.
As a layman, when I look at this, what I see as being an advantage to this type of treatment or psychedelic treatment is if I'm suffering from depression or I'm suffering from PTSD or some trauma-based thing that's now causing me to act out in one of these ways, perhaps in substance abuse or whatever. And once again, I'm saying this as a layman. I'm not a doctor.
Right.
But what seems to make sense to me is that these things reside in such a deep, profound place within our psyche. And I've had talk therapy. I've seen 3 therapists in my life. I've been on antidepressants, but there were times where I'm like, man, is this all there is? It's like we've talked and talked and talked. I want to feel better. And I'm not saying that people should not do that. I'm not saying that people should not use any of these treatments. But what you brought up earlier, you said that this can bring some immediate relief. And what I'm saying is also that within this altered state of reality, one might be able to more easily perhaps talk about, or I don't want to say relive, but vocalize or
resolve.
That's the word. This issue that we cannot deal with in a completely 100% sober, woke state.
Absolutely. Absolutely. And, when you can take someone from a place where they can't go to a movie with their family, they can't go out in public, they can't hold down a job, they're basically a prisoner in their own body, in their own home. When you can take a person like that and break those bonds and break those chains so that they can function in a healthy way in society, it's a beautiful thing. It's what we live to do. I mean, that's our passion, is we want to see that happen. And sometimes, people have had thoughts of suicide in the past, or they've come that close. And when you think, if you can save that one person, from that darkness that is so, just permeates their entire DNA and their every cell in their body, it's amazing. It really is. Once we finish an infusion series, you've attained a higher end of the dose range, because every infusion we go a little bit higher and a little bit higher and a little bit higher, depending on how they tolerate, without severe side effects. And generally people do that fine. So then whatever that end dose is that we ended with, that becomes their maintenance level. And then for some people, that might be a monthly infusion they come back to get. Could be every other month. It could be 6 months. It could be never. The results could last forever. That's probably that far end of the Bell scale, the tail end that you don't see often. Probably more the middle of the Bell scale is a maintenance dose of, every other month or every 3 months, once a quarter of the year. And when you think about, and I'm always careful to tell patients as we go through this, remain with your caregiver who
Mhm.
has been treating you for this. Don't stop your medication cold turkey. Do not adjust it yourself. However, when you finish this infusion series, you're probably going to need some adjustments. That is not my job. That is their job. And so our goal would be, hopefully they can go back to their provider and they can cull out, reduce some of the, many medications they're on, or reduce the dosages, because like most medications, the effects that a patient gets, the benefits and the side effects, are dose related. So if you can reduce the dosages of those, or the number of medications these folks are on, they're going to feel much healthier and much better overall.
Which you actually predicted what was going to be my next question, which was, how does this work with integration in existing, let's say I'm already seeing a psychiatrist, I'm seeing a therapist, I'm on an SSRI. My understanding is that to do ketamine infusion therapy, I don't have to stop the SSRI that I'm on.
Oh, no.
I can come in, because sometimes medications don't work together, but in this case, they will.
Right. The only medications that we require people not to take, which, we have to make sure they're not, is narcotics, benzodiazepines, such as Ativan or Valium or whatever, and any marijuana and that sort of thing. So basically any street drugs, so to speak, because those could interfere as well.
Understood. And are you getting, I don't know what it's like in the medical community. Is there any pushback from kind of the more square sides of the medical industry on this? I think, and I'm going to get political for a second, it's like, my body, my choice, my personal sovereignty of my body. If I feel like this is something that I need to do, I think I should have that right. Is there a rift within the medical community on the efficacy or ethics of this?
There's, there really isn't. There's so much research out there, and we've got it on our website for people to pull the articles and read themselves. But research has been done. There's more research that needs to be done, certainly, but there's enough research out there to support the use of this drug as an off-label drug. The FDA approves ketamine for anesthesia purposes and sedation, but it is not approved for, mood treatment-resistant mood disorders and chronic pain. Doesn't mean it's a bad thing. It just means that, for example, Viagra started as an antihypertensive.
Right.
And it wasn't, it was approved as an antihypertensive. It wasn't approved as an erectile dysfunction drug. Well, now it is. And so someday down the road, I think, as more and more of these clinics are treating people successfully and there's more information in the research, I think at some point the FDA is going to approve ketamine for these treatment-resistant mood disorders. Now, the FDA has approved ketamine nasal spray called Spravato, which is not an injection, either, intramuscular or by IV. It's something, that's administered in a clinic by a nasal spray. The FDA has approved that. So
for these symptoms or these issues,
for these exact symptoms. Yep. So, I'm hopeful that someday down the road, in the not too distant future, that the FDA will go, hey, if we've approved it in this manner, then why shouldn't we approve it by the other methods of delivery? And I think it should. That's my opinion. I'm going to get political for a minute too.
Go for it.
My opinion is that the bioavailability of what I'm doing, giving it to you IV, it's almost 100% of all the ketamine molecules are able to be utilized. When you spray it in your nose, 60% of it is what is bioavailable to you. The other 40% just doesn't work. Because, you do have a vascular area in your nose, but it's not directly into your system. It has to absorb through mucous membranes and then go through the walls of the vessels and travel around and all those things. So the bioavailability is not as high. Well, if the FDA approves ketamine as a nasal spray with a low
Mhm.
bioavailability, why in the world would they not now approve it with a better chance of, successful treatment? So I'm hopeful that will happen someday.
Isn't there also an oral form of ketamine?
And that's even lower bioavailability because it's got to be ingested by the stomach and go through the
Right.
first pass effect. So it's about 20% bioavailable. So it's almost like that, it's like putting out a fire with a water gun.
So, well, are you saying you really don't think there's much value at all there?
Well, I, someone might see some improvement, but if I were the patient and I'm that in such a bad state in a dark
Hmm.
place,
Yeah.
I'm going to want to do the thing that's going to give me the best chance of
Hmm.
success. And so we do have some clinics here in the Gulfport, Biloxi area on the coast, usually psychotherapy clinics that do provide Spravato, and they seem to do fine with that. But we, as a model, a business model, and wanting to help people, we said, they're doing that. Let them continue doing that. We're going to do the best bioavailability because, frankly, it is not cheap to do this.
Right.
You have to have healthcare providers, you have to have capital expense and equipment, safety equipment, crash cart. I mean, we're basically set up just like we are at a hospital or a surgery center. We have to be
Mhm.
because we want to make sure that our clients, are as safe as possible.
And
So,
right now, insurance doesn't cover this. Is that right?
right. And that's where that term off label comes in as a catch 22, because if the FDA has not approved it for this purpose, then our illustrious, insurance companies, Medicare, will not pay for it. So unfortunately, it is an out of pocket expense. Now, one of the things we do, again, we have to have enough to keep the lights on and
Hmm.
keep this service being provided. But one of the things we do is we try to provide packages for people, give them a little bit of a price break if they can pay for the package altogether. And we get a lot of people that, see the value in that. We also partner with some of the healthcare um, zero interest programs for a period of time. If someone has, a credit, moderate
Hmm.
credit or better
Yeah.
credit, then they're able to apply to these programs, and the credit card company will give them, anywhere from 6 to 18 months, 0%, and let them charge the cost of the infusions on that. And then the client can pay that off at their leisure. Of course, if they don't, by the term that they've agreed to, then there's interest involved. But
Sure.
it's certainly a way for someone to not have to, have the money in their bank account right now to do it when they need the help the most.
Can you give me an example of a person that you have treated that has had a successful outcome with this? Like maybe somebody who was in a really bad way and this has really helped them?
Sure. Well, one of our very first mood disorder infusions, we ended up, uh, first time I met this individual when they walked into the clinic. Um, you've probably heard the term a flat affect. We use that sometimes in talking about the way our patient interacts with us. I mean, this person was completely shut down, couldn't make eye contact, could very, just head hanging, shoulders drooping. The entire body language was, I'm in a bad place.
Hmm.
Had had a previous attempts at suicide, had used alcohol, abused alcohol, was not currently doing that. But, it was affecting the family, the children, the spouse. And so we were like, okay, let's do this. And it again sort of came with the first infusion going, this just isn't going to work, and it was a little difficult for him, to undergo the infusion. But then subsequent infusions went up to 6 infusions, and next thing I know, the guy's going on a cruise with his family, and able to, his spouse would come and tell me, she said, I've seen him laugh. I haven't heard him laugh in 5 years. And, he's joking. He's things that would normally just set him off and make him spiral. He's just taken with a grain of salt, like, a well person would. So, when you see that kind of dramatic improvement, it just makes us even more excited about the possibility of the lives we can help.
When you were talking earlier about OCD, and so OCD is another, I don't know if trauma is at the core of many of these things. Is it physiological? Is it biological? Is it chemical? Is it environment? Whatever. But people can have many different reasons for their psychological state or issues. But I would think with OCD, it would be another one of those things where, it's now such a core part of just the way that you operate. To break that down has got to be really difficult. And what are your options? Okay, I'm going to take some kind of drug for potentially the rest of my life, or I could try this. And I keep coming back to the whole thing that blows my mind about this, no pun intended, is this idea that it has an effect on neuroplasticity, and pardon my layman-esque aspects, but it's rebuilding dendritic tentacles, I think.
Correct.
So basically, this is all win-win to me. Because I'm thinking, okay, you're going to give me six sessions of this. How's that going to help me? Well, it's going to help me by potentially helping me rebuild part of my mind.
Right. And allow those messages and neurons to fire like God meant them to, and not be, stuck in a holding pattern where they're not functioning properly. It is that neuroplasticity that it helps reform. It even helps, some of the research suggests that it helps create new connections as well. So
that is quite profound.
It is. It really, it's a miracle. It really is. And, we are cautiously optimistic. We don't make any promises to anyone that this is, absolutely going to be their end all. But, we tell them, this can change your life. We've seen it happen. We're going to walk this journey with you. We're going to be right here beside you the whole time. And then, as we begin to see things change, we share that with the client because we want them to be encouraged that this is something that's going to help them. And it is, we're seeing the results in them. Second time this client came, the one I was telling you about, came back in, he didn't even look like the same person. Smiled, made eye contact, standing up straighter, and every time that and I think of another client that we had, I couldn't get 2 words out of him to start with. By the end of the series, I couldn't get him to hush. He just had so much to tell me. And that was wonderful. I wanted to sit there and hear every word because, it was such a change, a positive change for this individual. So.
Well, my next thought is, you're being quite humble and honest in saying that, we're not saying that this is the be all end all, but when I'm watching television and a drug commercial comes on, and out of the 60 seconds of the drug commercial, 30 to 40 seconds of it is this list of potential side effects. I think that something like this, I understand your need to be responsible in your descriptions of it, but I'm just saying as a consumer or a client or a patient, I could take that risk.
Right. It really, again, because we rule out people who are ineligible for ketamine therapy, our goal in that is that we don't have an untoward outcome, a bad outcome for a client. So when you're treating people who are eligible for it, I can't see that it could be a negative thing for them. Again, if you can improve your mental health situation, to make it oversimplified, 0 to 10, 0 is like can't even get out of the bed in the morning, and 10 is like you're hopping around like, everything's great and wonderful. If you can improve them to a 5 or 6 or 7, that's huge. I mean,
Yes.
that's really a win for that individual.
Well, Pamela, thank you so much for your time today. Tell everybody where they can find more information about Neurokare and about ketamine infusion therapy.
The website address is my neurocare, and care is with a K.com. It's that simple. myneurocare.com.
Thank you again to Pamela Binns-Turner and everyone at Neurokare for their assistance in the making of this episode. We are not saying that this therapy is for everyone, but simply wish to pass along the information. If you or someone you know is in immediate crisis and in need of counseling or emotional support, call or text 988 for the Suicide and Crisis Lifeline. In the last year, it's received 5 million calls, chats, and texts, and it is a free resource. Friends, if you enjoyed this episode, please subscribe to the channel and leave a like or a review. It means a lot. I appreciate it greatly. I have another episode in the works as we speak, so until next time, keep your heart and your mind open.